And my co-authors and I became concerned about a recent movement in medicine, one that's well-intended, but unfortunately, it will lower the quality of patient care.
He's talking about the healthcare industry removing race from medicine. After all, it's a social construct. It's not biological. It's not genetic. Many have theorized for years if we omit race when predicting and diagnosing disease, it will reduce health disparities and curb systemic racism in healthcare. But a new first-of-its-kind study raises some concerns about that approach.
We all know that people differ in many ways, so doctors should try to personalize care. An important aspect of this is to predict illness in patients as accurately as possible. Now, to do this, doctors should use whatever information they have about their patients, and this information, of course, includes race as well as sex and age and medical history and on and on. So when race has predictive power, when it helps doctors predict illness, it should be used along with the other information that doctors have. It shouldn't be ignored.
Charles Mansky was part of the research team using their voice of change to reach others in the medical field. He's a professor at Northwestern, one of 3 universities involved in that study. Now, ultimately, they found closing the racial health disparity gap and addressing individual health are not mutually exclusive. When asked for specific examples, Professor Mansky mentioned one condition Black people, Hispanics, Latinos, and Asian Americans are all at an increased risk for.
There's long been a kind of a model or an algorithm, if you want, to predict the chance that a patient will have kidney disease in the future. And there have been several predictive factors that have been used. They've been age and sex and the result of a standard blood test and race. And they've all been used, and you put them through some statistical analysis, and that gives you a piece of information that clinicians can use to predict patients' future kidney disease. And what's happened is that a major medical organization recommended removing race from that equation, which means that henceforth you predict kidney disease only based on age, sex, and the blood test without taking into account race. And as you can imagine, if you remove any piece of information, whether it's race or the blood test or age or sex, if you remove any of them, the predictions aren't going to be as accurate. So, but they recommended that, and that's been put in practice really all over the country.
Bottom line here, the study found this recent movement to not use race as one of the predictive factors is actually leading to less accurate predictions. So researchers concluded omission likely won't lead to the closure of the racial health gap. It will only lead to worse patient outcomes. And I think we can all agree, no one wants that.
Wow. There's so much work to be done to close that gap there in the medical field.
Yeah, I'm going to post that study on my Facebook page so you can read more into it, because they really dive deep into the other diseases that race is a factor.
Yeah,
very important
Glad
stuff.
they're doing that, absolutely.